Governments from the East African nations, 8 of them, have joined hands to come up with a comprehensive and collective response to the Ebola outbreak that has so far affected a number of countries in West Africa. Now, this move comes amidst mounting fears that the deadly virus has overwhelmed the countries owing to the number of people it has killed. The following report has more details.
East African governments have joined hands to come up with a coordinated regional approach against the Ebola virus. In a consultative meeting held in Nairobi, delegates from 8 countries intimated that Ebola virus disease is now posing an extraordinary challenge in the region, which requires broad measures to be put in place.
There are several efforts at different levels and settings to discuss the Ebola issue, and this is an indication of the seriousness and commitment that the region and the international fraternity are putting into the management of this crisis.
Last month, global health experts declared Ebola epidemic an international health emergency that requires combined global tactics. Regional health professionals have said that the outbreak of the deadly virus has caused economic effects that require global interventions.
Ladies and gentlemen, we are in uncharted waters. This is a severe health crisis, and it can rapidly become a humanitarian crisis if we do not do more to stop the transmission. Health workers on the front lines are becoming infected and are dying in shocking numbers. Others have fled in fear, leaving people without care for even the most common illnesses. This is diminishing one of the most important assets for the response of any outbreak. This heavy toll on healthcare workers further impedes control efforts and may cause an entire health system to crumble.
However, despite the social and economic threat posed by the virus, there have been regional concentrated efforts to curb the spread of the virus.
In terms of Ebola coordination, the country has set up a national Ebola task force that meets regularly to review the situation of Ebola in West Africa and also to inform the country on what is required to be done. Apart from the national task force, we have the technical working group that look at each specific thematic areas in terms of response to Ebola in case it comes to this country. We have 4 critical subcommittees that work on this. We have the surveillance, contract tracing and laboratory services subcommittee. We have the case management and infection prevention and control committee. We have advocacy, communication and social mobilization committee. And finally, last but not least, we have the coordination and resource mobilization committee for Ebola response.
2 weeks ago, the African Union health technical experts met in Tanzania to discuss health agendas, with Ebola outbreak emerging as the key agenda item. In Kenya, 20 cases of Ebola were suspected. However, none of the suspected cases have been confirmed. The Ministry of Health has, however, intensified efforts to ensure that there are no infections in the country.
We have ensured that we advise every health institution in this country to set a room or a space somewhere where we can use an isolation facility just in case one case of Ebola finds its way into this country. And most of the hospitals in this country have been sensitized and provided with PPEs just to be ready in case we get a case of Ebola.
The government has also allocated $7.6 million to help in response efforts in the country. Further, the Ministry of Health has established 2 Ebola hotlines through which any detected cases of Ebola can be reported.